Hey guys, Dr. McDonald. We're going to finish up the skeleton, and this is chapter 8, the appendicular. It's not quite as much as we had on the axial, so it's fairly simple. There's some difficult places, but it's all in all, it's way easier. Okay, the appendicular. I'm in the way again, aren't I? Come on, you. Move over here and get out of the way. Okay, the appendicular skeleton obviously is everything that's not the skull, the vertebrae, the sternum, and the ribs. So basically it's the arms and the legs and the things that they attach to, which is the pelvic girdle down here and the pectoral girdle up here. That's pretty straightforward. No matter where I move, guys, I'm in the way. I just do keep doing this, don't I? Okay, maybe I'll be okay over here. Clavicles and the scapulae. This is the shoulder girdle, the pectoral girdle. The clavicle is going to connect the shoulder blade, the scapula, to the breastbone or the sternum. And of course, the scapula is going to be the bone that the humerus is going to attach to. This attaches your arm to the rest of your body. These guys, they've got a lot of muscles in there, and that's something we'll talk about when we get to the muscular chapter. There I am. Okay, guys, let's see what else we've got on this. Provide attachment sites. That's pretty straightforward. Okay, the clavicle, and a lot of you guys have already seen this in lab. It's just review. The sternal end is kind of rounded like so, and the acromial end is kind of flattened. If you remember from the lab, the acromion on the scapula is also a little bit on the flat side, so they kind of easy to tell this guy. This is the anterior, and right there is where most breakages, fractures of the clavicle occur in the first 1/3 because it's bowing out, and that's the point of maximum stress. Okay, let's continue on. The scapula, I do need to move me out of the way for sure now. Okay, this is going to be on the back of the rib cage. It's going to sit somewhere between ribs 2 and 7. This guy is a flat bone for the most part. It does have some ridges and spines and all that, and this guy is going to be in the shape of a triangle. Now, on this triangular shape, this end right here will be the end that actually faces out. So this one, I'm looking at this from the front, that would have to be, I'm going to say that's a left clavicle, or clavicle, I'm sorry, left scapula. That's the front. No, I'm sorry. That is a right scapula. In any case, you don't need to know that. It's just kind of interesting. A lot of this stuff is not on our lab list, so we're kind of just want to focus on what we have. This guy right here is the coronoid, not coracoid, but coronoid. No, actually, that's wrong. That is the coracoid. I don't know why that says coronoid, guys. That is the coracoid process right there. Over here is the acromion process, or just the acromion. Remember, that's what the clavicle attaches to, the acromial end. This over here is going to be the glenoid cavity, glenoid fossa. You hear it both ways. This is where the head of the humerus is going to attach. Now, we've got some areas on here that we have big, important muscles that attach to. So this area is in the front. So this is going to be the subscapular fossa. It's just a very shallow area, and we have a big muscle that sits there. Now, if you look on the back, right here we have this dividing line, and this is called the spine of the scapula. This spine actually ends in the acromion. Inside this little area, it's almost like a little pocket. We call that the supraspinous fossa because it's above the spine. This is the infraspinous because it's below. That's not really hard, is it? Okay, as far as our upper limb, the arm, and technically the arm is only this upper part. This is going to be the forearm. I guess I can move myself back down again. Got about 30 bones. A lot of them are super easy. Okay, the upper arm bone is going to be the humerus, not your funny bone. In the forearm, we've actually got two bones. We've got the radius on the thumb side, and we've got the ulna on the little finger side. The wrist bones, they're actually 8 small bones, kind of cuboidal. These are the carpal bones. In the palm of your hand, you have the metacarpals, and then in the fingers and the thumb, you have tiny little bones called phalanges. We also use the same term for the bones in the toes, and it's okay. There's no confusion on that one. Okay. Oh, I'm in the way again. Let me move down here. Okay, the humerus, longest bone in the arm. This guy is going to, as we said, kind of go with that glenoid cavity. Now, the glenoid cavity is very shallow, and this guy doesn't fit. It's not like a real tight socket. That enables us to have this great range of motion, and as we said in the last chapter, also enables us to get it dislocated really easily. It's a trade-off. You got to have it. And this guy on the bottom is going to connect with the radius and the ulna. Now here is the head of the ulna, or excuse me, the humerus. Now underneath every head there is a neck. Now this little line that you see here, this little dotted line that goes around this circular portion, that's the anatomical neck. This is the only bone that we have 2 necks. That one's the anatomical neck. This one that goes around here is the surgical neck right there. It's just something we have to know, guys. Oh, now this is the front of it, where you can see. Now when I say front, I mean facing an anatomical position, right? With your palms facing forward. There's the greater tubercle and there's the lesser tubercle. The difference, well, this one's a little bit bigger, but it's higher up. This one's a little bit slightly lower down. In between here is the intertubercular groove. There's a very important muscle tendon that goes through there. This is the shaft, and right over here you can see the bone kind of bulks out right there. That's going to be the deltoid tuberosity. That big, strong, powerful deltoid muscle connects there, so the bone is increased in mass in order to deal with it. Okay, so on the arm bone, the humerus, we have condyles. Condyles are usually what connects to another bone. The thing that is immediately above the condyle is an epicondyle. That's not really too hard. There's the lateral, and this is the medial. How do I tell? Well, the head of the humerus is always going to face towards your body because it's got to connect. So anytime, whatever is on the same side as the head is the medial epicondyle. Whatever is on the opposite side is the lateral. Now, the condyles on here are not just called condyles. They got special names. Right here is the capitulum. The capitulum is where the radius kind of connects, sort of, with the humerus. This guy is the trochlea. The trochlea is where the ulna is going to fit onto the humerus. Now, if you look right here on the front, you got it's a hole, it's a fossa. It's not a real big fossa. We call that the coronoid fossa, and I'll tell you why in just a second. On the back, we have a deeper hole, and we call it the olecranon fossa. Here is the ulna. If you look, you see this guy's got kind of a C-shaped. That's C-shaped, and if you remember, the trochleus makes kind of a V like this. Yeah, it does, like that. And then the ulna, yeah, and the ulna has this kind of thing. This is called the trochlear notch. There's a little line that runs in that kind of runs off, kind of triangular shape. This guy on this side has a short process called the coronoid. So when you flex your arm, the coronoid process goes in to the coronoid fossa. This guy over here is the olecranon, or the olecranon process. When you straighten your arm out, that big olecranon process fits into that olecranon fossa. Now, this may seem kind of strange, but this is the actual head of the ulna. It's actually on the wrist side, or the distal, if we want to be correct, and we do. Over here, we've got a little piece of bone called the styloid process. It's this little bone right here on the back side of your wrist. Everybody can see it and palpate it. Okay, continuing on, we've got the radius. Now the head of the radius is opposite to the ulna. Its head is right there on the capitulum next to the humerus. We got a radial tuberosity again. This is for big muscles to attach to. And under every head you have a neck, unless you've been to a guillotine. This is the body. We don't deal with that. And then it has a styloid process. You can palpate it, you just can't see it from the outside. This is going to be the bone, and we call it the lateral bone because remember, in standard anatomical position, your thumbs are pointing outward laterally. Let's see. These guys, the radius and the ulna, are actually connected by a membrane, and we're going to talk about that. I believe I've got, there it is. Let me move me again so I can get out of the way. Oops. All right, that's better. So here's the they're not showing the humerus. There's the olecranon. You see that little line right there and how it falls away. That's the trochlear notch. Now, you don't have to know this, but there is a notch in the side of the ulna for the head of the radius to fit to. And of course, again, underneath every head is a neck, the radial tuberosity. Styloid process are all that they really require that you know. And these guys have got the interosseous membranes. These guys, we'll talk about that in the joint chapter. These allow our wrist, these guys, to do this number. And when we actually do this, we actually have to cross over, the radius crosses over the ulna. Okay, here's a good view of some of up close. There's that radial notch, but here's the coronoid. There's the olecranon process, the trochlear notch, styloid process, and let's see. Oh, this is the distal end. So there's the proximal end of the ulna, and here's the end. Now here is where most of the wrist bones, as a rule of thumb, and this is really kind of a rule of thumb, for the most part, the humerus attaches to the ulna. The radius is there, but it's not contributing very much. On the other hand, the wrist bones basically connect to the radius. And if you notice, the ulna is big on the end where the humerus is and small on the radial, or on the distal end. The radius is small up here, but it gets larger on the end that connects. Kind of makes sense. You can see there's the head of the ulna and that styloid process. This guy has got little areas. This one is for the scaphoid, and this is for the lunate. These are carpal bones, and we're going to be talking about them in just a second. Oh, let's see. Here's a picture, and you can see these guys kind of in there. There's the head of the radius, near the capitulum, the trochlea, and you see how that kind of makes that inverted V like that. And we already know that inside the trochlear notch is kind of the same way. It's just kind of makes it fit together all well. Now here they're showing an extended arm, so you don't see the coronoid process in the coronoid. You've actually got to flex your arm to do that. But down here you can see the olecranon process in the olecranon fossa. Again, in the epicondyles, and I mean, it's pretty much all the same as we've talked about. Okay, now let's go talk about the hands. The first thing we're going to do, the first bones in the hand that we're going to be talking about are the carpals. These are the guys that make up our wrist. And I'm sure everybody's heard of carpal tunnel syndrome, where you injure, or rather you don't, it's not so much injury, you strain them, you overuse them, and you get inflammation in this area. Unfortunately, there's a lot of nerves that go through there to get to the hand so that we can control it, and so you get a lot of pain. Now these guys are color-coded guys. So now there are 8 carpal bones. There's 2 rows. There's a proximal row and there's a distal row. Now if you start right here, this purple is the scaphoid. This is the lunate. Remember, these are the 2 guys that are going to attach to the radius. Over here is the triquetrum. And on our models, I know these guys are kind of fused together, but they are 2 separate bones. That guy right there is the pisiform, coming all the way back over again to the thumb. Trapezium, trapezoid, capitate, and hamate bones. This is a really good little thing right here, and you can see it. They got a very up close and personal thing. Okay, let's continue onward. The metacarpals, these are the bones in the palm of your hand. They connect to the carpals. Meta means beyond, so there's the guys beyond the carpals. We don't need to know any of these subparts. Basically, we just need to be able to tell which one is which. Starting at the thumb, 1, 2, 3, 4, 5. You can't get more simple than that. The 1st through 5th metacarpals, starting from the thumb. Phalanges, as we said before, we're going to find phalanges in the feet as well. You have to pardon my dog. He's a good watchdog. But in any case, we're going to find these in the toes as well. Now there are 3 phalanges in each finger, but the thumb itself only has 2. And we're going to see the same thing in the foot when we get there. Okay, 1, 2, 3, 4, 5. Now there is a little difference. The one closest to the metacarpals is going to be proximal. We already know that, right? The one furthest away is going to be distal. Got it? Now for the forefingers, we also have middle phalanges or intermediate. Middle phalanges of what we usually just teach, not intermediate. So either way, I mean, we're basically saying the same thing in just different words. So that's it. I mean, once you get past the carpals, the rest of the hand is basically counting 1 through 5. Alrighty, let's continue on. Okay, that takes care of the pelvic girdle and the arm. We're going down into the hip. And I need to move again. I may have to move me up a little bit. Okay. We have 2 hip bones, but the hip bones themselves are composed of 3 different bones. We'll talk about that. Sometimes they'll call these the innominate bone. I know that's a ugly name, big, long. Or the coxal bone, or os coxae. And well, these guys are going to be the guys that our legs are going to attach to the rest of the body. These guys have got some very strong ligaments because they're holding up a lot of weight. These guys are going to take the weight of the body and transmit it down to eventually to the feet. So the three bones of the coxal bone or hip bone, we have, now this guy is looking from the back. There's the ischium. It is the lower posterior part of the hip bone, the one that's marked here in blue. Here we have the pubis bone. Sometimes they call it pubic. I'm not that particular which way you say it, as long as you get it right. And of course, there's the pubic symphysis. We'll talk about that. We talked a little bit about that as fibrocartilage. So that's the same. And then the top portion is going to be the ilium. And of course, here looking again from the back, we know the sacrum is going to attach to the ilium on both sides, and that finishes our pelvic girdle. Here's another good one. This one is a little bit better because it shows you that the ilium goes down a little bit further. The sacroiliac joint is where the ilium and the sacrum actually come together. That is the ischium, and that's the part we sit down on. And of course, this is the other part. Now, well, I think I've got an actual individual one on the ilium, so I may wait till we get to that. If not, I'll come back, guys. Okay, there's the ilium. There's the ischium. That actually is pretty good right there. Like that. And there's the pubis. Nope, guess not. Guess I better come back and do it here. Okay, guys, there are landmarks on here you're required to know now. This is the inside or the medial part of the ilium. This is the outside or the lateral. This is the iliac fossa. There's a big, strong muscle that sits there. Over here, you see this notched out area. That's called the greater sciatic notch. This little area right here is called the lesser sciatic notch. This little pointed thing right there is called the ischial spine. Now, this is a ramus. That's the ischial ramus. That's the lower pubic ramus because they have a lower or an inferior pubic ramus and a superior pubic ramus. Here is that deep socket that the head of the thigh bone sits in, and it's called the acetabulum. I know it's kind of a name, but what can you say? Okay, here is the iliac crest. That's the top of the iliac, the hip bone. Now, this in the front is going to be the anterior superior iliac spine. Down there is the anterior inferior iliac spine. So on the front of the ilium, you have two spines, one on top and one on bottom. In the back, you have the same thing. You have a posterior superior and posterior inferior iliac spine. It's just one of those things you're going to have to learn, guys. So how do I know which one is which? Well, this ischial tuberosity right here is always going to be in the rear. So that's going to give you the posterior and anterior. And of course, this guy right here, the acetabulum, is going to tell you whether it's in or out. So it's not too bad. Let's continue through. Now in the lab, we talked about male and female pelvises, that they were different. So I found a great picture. This is a female pelvis. Notice how long and round it is, very oval. This is a male pelvis. Notice how it's more like heart-shaped. If you look under here, you see there's the sacrum and the coccyx. It's not pointing in very much, But here you see the male, it actually points in, it actually curves into the, let's see if I can do this, actually curves into the pelvis very, very significantly. And these guys, these ischial spines, remember we talked about those, they're a little bit closer together in the male than they are the female, because the female has to be able to push a baby through that in order to get a baby born. So kind of makes sense. You can look at a skeleton and tell. I usually just look at the sacrum first. If it's pointing very far in, then I know it's not. But whichever way you want to do it, you can tell a male from a female. And child purse, true pelvis, which is below the pelvic brim. That's for the beginning of the birth canal. It's very broad, shallow, and it's got a great capacity. Ours is tilted less forward, and it's more about holding a male's heavier weight than it is bringing a child in. Okay, comparing these two again, the bone thickness, lighter, thinner, smoother. Males are heavier, thicker, and more prominent markings. In other words, all those things that stick off the bone. The pubic angle, now this is something, let me go back. Here's this pubic angle right there. If you look between the pubic bones, this guy is anywhere from 90 to 100 degrees, but the male is 60 to 70, so it's considerably, instead of being like this, it's more like this. Because again, you know, the male is not going to be delivering a baby. The acetabulum are smaller, further apart, large, closer together. Sacrum we've already talked about. Coccyx more movable, more straight, and it curves to the front in the male. Okay, let's talk about the lower limb. Technically, the leg is what's below your knee, and this is the thigh, or the femoral region. This guy has got to take all the weight of the body and bring it down to the ground, and so it can be supported. This guy has got a lot of pressure, a lot of force on him. The thigh has one bone called the femur. It's the largest bone in the human body. The actual leg itself has two bones. We have a big, thick tibia, and then we have a fibula, which actually doesn't bear any weight. And then when we go down to the foot, we, instead of having carpals, we've got tarsal bones. There are 7 tarsals, not 8 like with the carpals. But then we have the ball of the foot, the area between the toes and the back of the foot. Those are going to be metatarsals, and we've still got phalanges like we talked about. We'll get to all that. I'm in the way again, guys. Let me move over here. Largest, strongest. This guy is going to fit into the acetabulum of the hip bone. And of course, you've got a head. Underneath the head, you've got a neck. Fovea capitis is that little dimple in there. Now, this guy, looking from the back, has got 2 little markings. These are not tubercles like we had on the humerus. These guys are called trochanters. That is one of the most common mistakes that I see folks make. They will call a trochanter a tubercle and a tubercle a trochanter. You got to get it right, guys. Inner trochanteric line, I don't think that's on our thing. Gluteal tuberosity, that's for the gluteal muscles, but it's not. The linea aspera, it actually comes to kind of like a little ridge there. Now this guy has got condyles and epicondyles. The lateral epicondyle is going to be on the opposite side. The medial epicondyle is going to be on the same side as the head, because the head has got to be on the medial side because it's got to attach to the body. And then underneath you have the condyles, the very smooth regions that are going to connect up with the tibia. And in front of this we have an entirely separate bone called the patella. It's one of those sesamoid bones, and it is actually contained inside a tendon of the quadriceps muscle in front of the knee joint. And I'm guessing they do that. That's for protection. Okay, guys, tibia. Tibia is the shin bone. This guy is very close to the surface, so when you hit something on your shin, you get to stimulate all those many nerves in the periosteum. So again, you've got a lateral condyle and a medial condyle, and between them you've got this intercondylar eminence. That's not too bad. The tibial tuberosity is right underneath the head of the tibia, and it's going to be a kind of a thickened area. You can palpate that on your knee very easily. And just like with the radius and the ulna, we've got this interosseous membrane. Unlike the radius and the ulnar, these guys do not move. That's not their function. Not supposed to do that. Now, if you look here, I know it's kind of hard to see, but the tibia is always on the medial side of the foot. It's on the side with the big toe, okay? The fibula is the other bone, and I'll talk about that in just a second. And as we said, it really doesn't bear any weight. All of the weight, the fibula, if you see it, attaches to the side of the tibia. This is the guy that's going to take all that weight from the body and send it down to the foot so that it can bear it. These guys don't have styloid process, although folks will get this wrong. One of the tarsal bones is going to fit in there, and this guy's kind of like, let me see if I can do this so you guys can see. I guess like that. The tarsal bone is going to fit in like that so we can move our foot. These guys are called medial and lateral malleolus. The medial is on the tibia and the lateral is on the fibula. And again, you can always tell when you see the malleolus, that's going to be the medial side. So whichever condyle is on the same side is the medial condyle. Here's looking at it again. Oops, I'm in the back. Here's looking at it again from the rear, and this time talking about the fibula. No weight bearing, doesn't connect with the femur. There are muscles there, the interosseous membrane, and these guys connect at the top and the bottom just like the radius and the ulna. And this guy's always going to be on the lateral side, and so he's going to give off that. The only thing that they have is the head of the fibula, the lateral malleolus. I don't even think they've got the neck on there. I mean, I'd have to look. Okay, let me see if I can find a place to rest for a second. Well, let's go over here. Okay. And we don't have too many more slides to go, guys. Well, this is the wrong place to rest at. The tarsal bones, I told you about these guys. They're like the carpals. These are going to form the ankle joint. Now, there's 7 of these. There is a little bit of a shortcut, so let's go through this. This guy right here is the heel bone. He's going to be called the calcaneus. He's the one who's yellow. This brown guy right here is the talus. He's the one who fits in between the medial and lateral malleolus, and that's why we can dorsiflex and plantar flex our knee or our feet. Okay, so there's the calcaneus, there's the talus. The next thing we have right here is the navicular. It's going to attach to the medial side of the calcaneus, and on the lateral side we're going to have the cuboid bone. That's pretty straightforward. Calcaneus is real easy. Talus is easy. It looks kind of boxy, to be honest, and you can see that it's really intended to fit in between the two malleoli. So there's the navicular, and here's the cuboid. Now we've got these 3 bones. These are all called cuneiform. How do you differentiate them? Well, your big toe is on the medial side of your body. So this one that's connected to this metatarsal is going to be the medial cuneiform. This is going to be the lateral, and this guy in the middle is going to be the intermediate cuneiform bone. So these aren't, I think in a lot of ways, these are a lot easier than wrist bones, but everybody's got their own opinion. Metatarsal bones, the ball of the foot, 1, 2, 3, 4, 5. That's it, guys. Same as in the hand. Phalanges, we've got the same situation. All the toes, all 4 of these toes have 3 phalanges, a distal, a middle, and a proximal. The big toe only has 2, proximal and distal. How do you name them? 1, 2, 3, 4, 5. So if you saw something that pointed to this guy, this end bone right here, that would be the 5th distal phalange. That's all you got to say. Okay, other thing, we'll talk about foot arches. We know we don't exactly sit flat-footed. I mean, there are folks who have flat feet, but these guys interlock. We got tendons and ligaments that help our foot to curve. So we've got these longitudinal, in other words, it goes from front to back. Our foot, you can see how you've got these angles here. The medial, of course, is near the big toe, and the lateral on the other side. We also have a curvature that goes from side to side called the transverse arch. These guys keep our bones from trying to transmit that weight to the ground. Much easier if they don't do that. Here are some of the things that can go wrong. There's what a normal longitudinal arch. This one is called hollow foot. In this case, the bones are overly arched. And here, of course, is what we call flat-footed. And this is, the arch is really not there as much as it should be. Well, that's it, guys, for Chapter 8. Let me come up back here so I can say bye. Not a whole lot to this, but you need to study it. All right, I'll see you in Chapter 9, guys. Thanks a lot.